What's going on, everybody? Welcome back to my channel. My name is Dr. Tom Walters and I'm an orthopedic physical therapist. In today's video, we're going to do another partner manual therapy video that you can use at home to help reduce pain. In this particular video, we're going to look at the tibialis posterior muscle, which runs on the kind of inside of the shin and runs all the way down and attaches in the arch of the foot. I have another video that shows exercises for this muscle, and I will link that at the end of today's video. So if you've got a partner available and you have pain kind of on the inside of the shin, maybe down in the arch of your foot, it could be you're a runner, maybe you're doing hiking, maybe even just with walking, you're getting pain somewhere in this region. This is a massage technique that you can perform for just, maybe 5 minutes that can be really helpful. I use with quite a few patients. Now I'm going to use some lotion here on Kirsten's skin. I've got one called Free Up that's kind of a hypoallergenic massage cream. I'll put a link for this down in the description box if you need something. Otherwise, you can just use regular household lotion. What you're going to do is apply that kind of through this inner shin region. Again, behind this bone, the medial malleolus, the tibialis posterior runs through here. Its tendon goes behind the bone and then attaches again down here on the inside of the arch. So what I like to do is just spend a few minutes kind of first finding the muscle, and then I'm going to use my fingers. So you'll find this bone. This is part of the tibia, kind of your shin bone. You're going to find that bone and then kind of follow it backwards right until you come off of that bone, and tibialis posterior will be in that region. So I'm just going to follow the bone all the way down, kind of the edge of it, and apply sort of moderate pressure. You really want to apply pressure to the your partner's tolerance. So you want to find a pressure that they feel like is therapeutic. You're not trying to kill them. If it's too light, it's not going to do too much. If it's too heavy, they're just going to tighten up and guard, and that won't be helpful either. So just kind of work along that region. Just run slowly from the upper end of the muscle down towards the bottom, and then all the way down to the arch of the foot. Kind of right down here to this navicular bone is where the tendon attaches. So that's kind of your ending point. So really you're just going to spend, again, maybe 2 to 5 minutes just kind of working through here slowly, checking in with them. If they're grimacing and it's hurting, just make sure to kind of back off. If they feel a spot that's particularly tender, sometimes I'll kind of really slow down on those areas. You can even pause and hold there for a little bit of extra time. But just spend, again, just a few minutes kind of working through here. Manual therapy can be really helpful for reducing kind of more acute painful symptoms. So once that pain starts to dissipate and get better, then you would want to start gradually loading and strengthening the tibialis posterior muscle and its tendon. And again, I will link a video at the end of this that can be helpful. Okay, so give that a try. Put any questions down in the comment section if you have them, and I will see you in the next video. Bye. Thanks for checking out today's video. I hope you find this manual therapy technique to be helpful. If you need a more comprehensive program for this issue, I'd recommend checking out the shin splints program in my book. My book's available on Amazon and Barnes & Noble and has rehab programs for the entire body. If we go back to the ankle and foot chapter, you'll find the shin splints program. And as we get into the program, you'll see that it has 3 phases and pictures of me doing all the exercises. There's even a tibialis posterior mobilization with a ball or your own fingers if you don't have a partner. This program will then take you through other stretches and exercises to help improve mobility and strengthen tibialis posterior and its tendon. So again, all the programs in my book are meant to help you do your own physical therapy at home. It has programs for the entire body. I will also link another video here with a few exercises for tibialis posterior, but again, if you need a more comprehensive program for the most common conditions, I'll put an Amazon link for the book down in the description. Thanks again for checking out this video. I'll see you in the next one. Bye.